There has never been a more important time to protect our health and the health of those around us than now. Standard hygiene practices in correctional environments are still our most important defence against the transmission of infectious diseases such as COVID-19. These practices include regular, thorough hand washing, cleaning and disinfecting, and more recently, social distancing. But the use of personal protective equipment, or PPE, is becoming increasingly important to further protect our officers during the COVID-19 pandemic. PPE creates a physical barrier between a person who is suspected or confirmed of having COVID-19 and others who may need to come into close contact with that person, such as our officers or medical staff. PPE is not just a mask, it can include gloves, gowns and eye goggles or visors. PPE does not have to be worn at all times, and it is important to use this equipment sparingly to ensure that there is adequate supply for staff and situations where it is critically needed, such as for health staff conducting testing or caring for active cases. Your General Manager or a Queensland health professional will advise you when to use PPE. Due to limited stocks of PPE across Australia and internationally, it should be used only when clinically indicated. When prisoners are suspected or confirmed with COVID-19, Queensland Health staff will place notices on the door or wall outside of any isolation cells, describing the precautions needed and the required PPE to wear. More than likely, the prisoner will be cared for in hospital, but an isolated cell may also be an option depending on whether the prisoner is well or the availability of hospital care. In some cases, a nurse may need to visit the patient in their cell. It is strongly advised that officers present stand at least 1.5 metres away, but this will be determined by the officers based on a risk assessment. PPE is only necessary for officers who are required to be in close contact and when cleaning cells that have been vacated by infected prisoners. If it is needed, Queensland Health staff will set up a PPE station outside the cell of any confirmed cases. Officers will find PPE and a plastic-lined bin for PPE disposal at this station. QCS is also in the process of sourcing extra PPE, which will be held centrally at Brisbane Correctional Centre and transported quickly to other centres if COVID-19 cases are suspected or confirmed. In order for PPE to be effective, it is important officers know the correct way to put it on, take it off and dispose of it. Hand washing before and after wearing PPE is also extremely important. Our friends from the Auckland Regional Public Health Service in New Zealand will demonstrate the correct use and disposal of PPE, and we thank them for allowing us to share this vital information with our officers.
Where practical, put on your personal protective equipment before you enter the room. Otherwise, maintain at least a 2-metre distance from the patient. Wash hands with soap and water or use an alcohol-based hand sanitizer before putting on all personal protective equipment. Fully cover torso from neck to knees, arms to end of wrists, and wrap around the back. Fasten at the back of neck and waist. Secure ties or elastic bands at the middle of head and neck, or behind ears. Fit flexible band to nose bridge. Fit snug to face and below chin. Place eye protection over eyes and adjust to fit. If you wear glasses, place the eye protection over the top. Make sure gloves extend to cover wrists of gown. Make sure to keep hands away from face. Limit the surfaces touched. and change gloves when torn or heavily contaminated. Peel off first glove. Hold removed glove in gloved hand. Slide fingers of ungloved hand under remaining glove at wrist and peel off second glove over first glove. Discard gloves in a clinical waste container. Perform hand hygiene. Remove eye protection from the back by lifting earpieces. If reusable, place in designated receptacle for processing, otherwise discard in a clinical waste container. Unfasten gown ties, taking care that sleeves don't contact your body. Pull gown down away from neck and shoulders, touching inside only. Turn gown inside out. Roll into a bundle and discard in a clinical waste container. Perform hand hygiene. Grasp bottom ties or elastics of the mask, then the ones at the top, and remove without touching the front. Discard in a clinical waste container. Wash hands or use an alcohol-based hand sanitizer immediately after removing all personal protective equipment. After the patient has left, wear gown and gloves and wipe down all hard surfaces with a virucidal disinfectant. Reusable eye protection and medical equipment that has touched the patient must be wiped down with a virucidal disinfectant. Dispose of wiping agents in a clinical waste container.
Queensland Health staff will also demonstrate to QCS officers how to correctly put on and take off PPE if and when we have cases in our correctional environments. Remember, PPE is not a substitute for good hand hygiene, cleaning and social distancing, and even the best PPE does not give 100% protection from infection. However, in combination, all of these approaches will provide us with the best defence we have available.